Jim, thanks so much for sharing your story with us.
It's a pleasure.
So, what's your background? What do you do?
My background is in psychology. I have a doctorate in psychology, and so I'm very interested in health issues that go with that because I find if you're working on your body, your brain's doing a lot better as well.
True enough. And you had certain challenges that you were pursuing some treatment for. What were they?
I did. I have two specific ones, and they were very old and chronic. The first time, about 25 years ago, I got a lung infection when I was in the Andes in South America, and I never recovered from it fully. The inversions here made it very difficult in wintertime. And Reagan had suggested trying the stem cells in my lungs, and it made a huge difference. I had it a few years ago. So during this time of year, I don't feel any symptoms in my lungs whatsoever, even with the bad air that comes in here in January.
Wow. And we say here, you're talking about Salt Lake City.
Salt Lake City.
Yeah. And that was like fairly immediate, or how long did it take before you started noticing the differences in your lung function?
About 2 or 3 months.
2 or 3 months. And still to this date, no problems?
No problems.
Wow. And what else did you do?
Well, about 30 years ago, I hurt my neck in high school sports, and I literally broke it, but I didn't know it at the time. And so I've been living with this pain for decades. About 6 years ago, I had about 2/3 of my neck fused to try to deal with the pain, and it didn't do anything. It may have stabilized things with the screws they put in, but...
So you went through this whole surgery, and at the end of it, you had no pain relief?
Zero.
Wow. Wow, that'd be kind of discouraging. So
was.
Psychologically, since that's your background, what was the impact of that?
Well, I think when you have a chronic health issue, it's with you every day. It's always working on you if you know it or not. And I think it creates just a little bit of grief and loss in your system with having that constant pain with you. Even when you go to sleep, I think it's there.
Yeah. So what did you do? What was the next step after your surgery?
Well, Reagan eventually suggested I try stem cells in my neck. Even though my neck was fused, it wouldn't go into the bone, but the muscles around the neck have been chronically in a spasm for decades. And so he put the stem cells on both sides of my neck. And it took about 3 months, but then I did feel a very noticeable difference in the pain. My neck muscles relaxed because apparently there was some nerve damage, but having released the tissues, everything just felt stronger, the tissues were softer, and that actually took away more of my headaches than anything.
Oh, you're getting headaches too as a part of that?
As part of that.
How long ago was that treatment?
About 3 years ago.
And 3 years later, you're still noticing that the benefit is there?
Absolutely.
Wow. So was there anything else you did in addition to the stem cells? Were they doing acupuncture, nutrition, or anything else, or was it just pretty much straightforward stem cell therapy?
Well, I'm glad you asked. I've been a patient of Reagan's for 15 years, so I really trust him. When he makes a recommendation, I always listen, and I end up doing 100% of it eventually. So for him to bring up stem cells with me, I thought I was going to listen. I thought might as well go through with it and see what the results would be.
Right. So you were getting these other therapies already, so this was the one thing that was added. And
correct.
Yeah, any other changes in your life that you noticed once you started doing this? Obviously the neck pain went away. You can do more activities of daily living, I imagine, as a consequence of that. Was there any other health benefits that you might have perceived as a result?
Well, especially with my lungs. I like to be outside like most people do in Utah. I was not winded anymore. I used to exercise a lot. I still exercise even with the bad lungs, but I noticed I wasn't more tired afterwards because my lungs had been damaged.
Right.
I feel like a normal human being. I felt I was just properly fatigued, and then I felt great the next day.
Well, I've got a great question for you because of your professional background. As we're talking to other patients, throughout the country who have been going through different therapies trying to solve their pain issues, sometimes the question comes up where people say, well, maybe it's just a placebo, or how much of this is in their head. What's your point of view on that? Because this is an area that you would understand.
Well, I can't speak for other people, but I did not think this was a placebo because I'm pretty scientific, even on the mental health side, but also when it comes to my neck, I don't think a placebo would work. I've tried so many things. In fact, I initially had some resistance in doing the stem cells because I have tried everything that I could think of. Nothing worked. So I was a little fatigued at trying something new and having it not work. And so when it worked, I knew it was not a placebo effect.
Well, what's interesting is, you mentioned surgery. What other types of things did you do before the surgery to try to solve the problem?
I had done different rounds of physical therapy. I did a long time of chiropractic care. In fact, a chiropractor referred me to Reagan years ago because he thought he couldn't help me as much for the pain issues I was having, and Reagan is the person that started me on my journey to start feeling a lot better.
Right. Wow. So you were definitely committed, it sounds like, to getting this figured out. And I guess motivated, obviously, if you're living with it every day.
Yes.
Yeah. So in your own practice, when you're working with patients, are some of them people that are dealing with chronic pain that you're trying to, help them psychologically deal with the problems, or is it really a different type of practice that you have?
Oh no, I think in a lot of ways the body keeps the score of how we're doing mentally. And so probably 2/3 of my own patients are probably experiencing some sort of physical health. And so I refer people to Reagan for acupuncture, and then when someone is looking at doing stem cell, I tell them it helped me a lot.
Yeah, so it's interesting because if that's the case as you describe it, then having sort of these alternative solutions. Because I imagine a lot of these people are taking medications, and maybe were you taking medications also prior to this?
A lot of medications. I was taking a lot of Excedrin, ibuprofen throughout the day. Every once in a while, I'd have a prescribed painkiller.
Yeah. And did you have concerns about what that might be doing to your body also?
Of course, especially what those medications do. They put a lot of stress on your liver and kidneys, and there's other ramifications probably in the brain, but I would rather be out of pain, at least at that moment.
Yeah, I understand that. It's interesting, because I share a story. Why I'm a chiropractor is a high school wrestling injury, to my neck that, got me on that path. So I sort of
So
get
you
that.
get it.
Yeah, I do. Well, really fascinating. Any other things that you think you'd like to share relative to your own personal experience?
I would. As a professional, it's helpful to have Reagan available for all sorts of health issues, if it's acupuncture or stem cells, because when I refer someone to him, it's also my own professional reputation online.
Right.
The good news is it always goes well with Reagan, and then my patients are happy. With myself, it's done. I just can't speak enough for the treatment I've received in here through, I mentioned acupuncture and stem cell, but the herbs Reagan prescribes are always dead on. I always feel an immediate effect from any herbs he adds to any sort of pain management or other health issue I may be having at the time.
How tough was it, if it was tough at all, to wrap your head around this sort of different mode of care? Because none of this is traditional medical, Western medical treatment, at least, and you with your academic background probably were brought up in that frame of reference. So was it difficult for you to try to get your head wrapped around things like acupuncture and herbs and other such things?
Not at all. For whatever reason, I like to keep an open mind with things. Plus, one of the founders of our field talked about a statement. He said, God is in the diseases. So in some ways, the diseases are teaching us things we need to learn, but we're not meant to suffer in them.
Right.
They're just to teach us things.
Well, quite a bit of wisdom there. So thank you very much for sharing your story with us, and for the work that you are doing in helping people, and hopefully it will help a lot of other people out there.
It's a pleasure. Thank you.